There, you guys, and welcome to episode number 22. 22, you guys, of Get Your Ass Up and Move Fitness and Nutrition podcast. I am your host, Peter Gay Barrett with Barrett Fitness Enterprises. And on this podcast, we discuss fitness, nutrition, overall health, and overall well-being. Tonight's topic of discussion is managing your polycystic ovary syndrome with diet, nutrition, and exercise. PCOS affects 1 in every 10 women in our country. Polycystic ovary syndrome is a hormonal disorder that causes an overproduction of a certain hormone, which in return or as a result of those overproduction of the hormone create multiple cysts on a female ovaries. Women who suffer from polycystic ovary syndromes usually struggle from being overweight. They usually struggle with obesity. They usually have issues with acne. They usually have issues with excessive hairiness. Maybe it could be like hair on your face. And baldness. Another issue that they sometimes struggle with is some kind of male baldness, or maybe some kind of patch or baldness in your head that mimics that of a male, because the overproduction of the hormone is usually a male hormone. And remember, you guys, the overproduction of these hormones as a result create multiple cysts on a woman's ovary. Some of the other symptoms, if not managed, this can cause heart disease. It can cause diabetes. It can cause high blood pressure. It can cause endometrial cancer. Women with PCOS also are oftentimes have higher than normal insulin levels. Now, your insulin is a hormone that's produced in your pancreas, and this helps the cells in your body to break down glucose or sugar into energy. Much of this insulin can cause your ovaries to create multiple cysts. Now you ask, what can I do? How can I naturally manage my polycystic ovary syndrome? You guys, we can manage it with the food that we eat. We can manage it with lifestyle changes such as exercises. And it's not a cure for it, but it can help to manage and therefore reduce some of your symptoms or some of the issues that you may have as a result of this syndrome or disorder. So, foods that are great to help you manage your polycystic ovary syndrome are foods that are high in fiber. So most of your fruits and vegetables, you guys, are high in fiber. So you talk about my smoothies. Having a smoothie on a daily basis, you guys, a healthy smoothie, one similar to the ones that I make, can actually help you to manage your PCOS. Because most fruits and vegetables are high in fiber. So I'll give you an example. I will make a smoothie with spinach, kale. I'll put some turmeric in it. I'll put some ginger in it. I may squeeze a little bit of orange juice in it. And then I may put some flax seeds and chia seeds. That is a healthy smoothie. Pour some water in, leave out the sugary stuff so you don't have to add any juice or protein powder or protein shake or whatever. Just your fruits and vegetables and your water on a daily basis. Having a smoothie similar to that one. This can help you to manage your polycystic ovary syndrome. What I do recommend, you guys, is to avoid carbs such as white breads, muffins, sugary snacks, and drinks, your processed meats. So again, you guys, foods that are high in fiber, like almost all your fruits and vegetables, it's a great way to help you manage your PCOS. And a way to do that is to start making a smoothie every day. Go out and get your ass up and move to the store or you can even sit down and do it on Amazon or something and purchase you a NutriBullet today, you guys. I am not working for NutriBullet. I'm not promoting them. Again, I wish I was, but I am not. But I live by making a smoothie on a regular basis that's full of fiber, that's full of just your fruits and vegetables and your seeds and nuts and so forth. So another way that you can help with your diet or your nutrition to help manage your PCOS are lean protein, such as fish, like your salmon and your tuna. Now, lean protein, such as your salmon, and are high in omega-3 fatty acids. And this is another great way to help you manage your PCOS. Try your best to stay away from red meat. I don't recommend red meat. I don't think that's a way that you can use to help you manage your PCOS. But I know for a fact that lean protein, like your fish, such as your salmon and your tuna. Now, other ways that you can manage your PCOS with your diet is to add foods that are anti-inflammatory. Now, you see me add turmeric into a lot of my smoothies, you guys, and turmeric is a great antioxidant, and it's also a great anti-inflammatory, full of anti-inflammatory agents. This is a great way to help you manage your polycystic ovary syndrome. So you're going to make a smoothie every day, on a daily basis, or at least 5 days a week. Okay, at least 5 days a week. And you're going to add your fruits and your vegetables. You're going to add a little bit of turmeric powder if you choose, so you can use the turmeric root if you would like to do that. But your fruits and vegetables and your spices or a root such as turmeric, those are all foods that are good, nutritious food that's going to help you manage some of your symptoms and manage your polycystic ovary syndrome. Now, other food that can help reduce inflammation are foods such as tomatoes, kale, spinach, almonds, walnuts, olive oil, avocado. That's another great healthy fatty food that's gonna it's just a good healthy, people call it a superfood. I'm not really big on that term, but avocado is just great healthy fat, just like your lean fish. That's going to help you to manage your polycystic ovary syndrome. But try your best, you guys, to stay away from carbs, sugary carbs and white bread and white pasta. Try your best to stay away from processed meats, any kind of, cold cut and, that type of stuff. Just try your best to stay away from that. And then with exercise, as we all know, exercise will help you manage a lot of ailments and syndromes and disorders and diseases that we have. So get on a daily exercise routine. It doesn't have to be anything high intensity or anything crazy, doing, anything crazy. Just get on a routine. If you want to do yoga, if you want to do Pilates, if you want to go for a walk every day, if you want to go for a jog every day, just start on, on a workout routine. Meditation, that's also a great way to help your body to manage your polycystic ovaries syndrome, you guys. So I will leave you with this, you all. All hope is not lost for my ladies out there that, struggle with this disease. I have a very good friend of mine. This video is for her. And it's something that she struggles with. And, as long as I have known her, she has struggled, with it. And, she have a lot of these symptoms that I mentioned. And, she asked me the other day, Peter Gay, can you tell me some foods and so forth that I can use to help manage my polycystic ovary syndrome? She started on making a smoothie and she's already seeing, some effect from having a smoothie like this on a daily basis. So all hope is not lost, you guys. You can manage your polycystic ovary syndrome with your nutrition, your diet, and exercise, you guys. So thank you all so much for tuning in to yet another podcast. Special thanks to those of you who have subscribed to my podcast. If you don't know where to find it, it's available on Apple Podcasts. It's available on Spotify. You can find it on my blog at barrett.fitness, which I will put in the description below. You just click on barrett.fitness. It will take you to my blog. Hit on podcast or on blog, and you will have access to all of my podcasts. If you haven't already, go check me out on YouTube, you guys. I'm recording this podcast for YouTube, so this will be posted there. I don't put all my podcasts on YouTube, but this one will be posted there, you guys. So hop on over and give your girl a subscribe. Comment on my videos, share my videos, like my videos, and turn on that notification bell. So every time I put out a video, you guys will get an alert. Once again, thank you guys so much for tuning in to episode number 22 of Get Your Ass Up and Move Fitness and Nutrition Podcast. Get your ass up and move, y'all. I'm about to.